to me about some of the best practices that you've learned in terms of telepractice. You've mentioned a couple, um, making contact and being in good communication with the schools. You've talked a little bit about materials. Are there other areas that it's important for particularly beginning telepractice clinicians to know?
I think it's really important for them to start out with having the background to know all the things around policies and procedures and regulations and things like that. It's just kind of a given. They need to do that work on their own. They need to research that. And there are certainly sites through ASHA and other places, but ASHA specifically has some very nice things already listed for people that I think are important because it ties right into our license and code of ethics. And in terms of best practices for the work, so we need to make sure that telepractice is comparable to in-person services. And with that, I think it's important that people not just say, I'd like to try to do this, but they actually work on skill sets so that they are providing a quality session in telepractice for their client and not just to fill a need. It's very important, very, very important. And I think when you're looking at best practices, understand that it is a continuum. Your skill set will change over time. You will get better if you're intentional about wanting to get better. You can learn an awful lot by doing it. And as I said earlier, reaching out to peers helps. But on the other side, if you ask questions, for example, at the end of a session, if you ask your facilitator or e-helper, for feedback, what worked, what did not work, make sure you listen and make sure that they understand that you're going to do something about that feedback so that they understand that they have value, that they're contributing.